Hello dear patients. Today we are going to review the case of herpes genitalis on the breasts. A woman came to us with ulcerations in the area of folds on the breasts. You can see it on the picture. She didn't have classic sexual contacts. She had some petting, but she didn't have sexual contacts for a long time. On observation, these ulcers were quite deep, quite dense. They localized in this area. My first guess was about streptodermia. You can watch a separate, more detailed video about what streptococcal impetigo or streptodermia is on our channel. Culture tests for bacteria were taken to determine streptococcal sensitivity to antibiotics. Also, such analyses as syphilis were taken from the surface of rashes, herpes, etc. As a result, after taking analysis, I prescribed broad-spectrum antibiotics as well as external medications with antibiotics like zinerit solution, healing ointments like levomecolum, injection antibiotics in the beginning of treatment. However, on the following day, analysis showed that it's herpes genitalis, which was quite surprising both for me and for patient herself. Indeed, she had contacts with the area of breasts, different games, but there was no sexual contact. She never had herpes genitalis before. Blood was taken for herpes genitalis, and as a result of that, both analyses for herpes genitalis and antibodies in blood were negative. Then, in search for causes of such relatively unusual rashes for herpes genitalis, immunogram was taken, where it was a quite marked decrease of immunity both in humoral and in cellular chain. This was the cause of such unusual localization of primary lesion and such unusual clinical picture with quite deep ulcers. In addition to antibiotics, anti-herpetic medications were prescribed, immune medications based on immunogram. This was done by immunologists. Ulcers were healing quite slowly, and this was possibly due to a decrease of immunity. This was also a primary episode of herpes genitalis, as there were no positive antibodies or PCR in blood. Therapy was done for 2.5 to 3 weeks, and after that, these ulcers gradually scarred. Later on, in control analysis from the surface of rashes, there was no herpes, but antibodies to herpes genitalis appeared in blood, which indirectly indicates a primary episode of infection. So, what does this case tell us about? First of all, it suggests that even when the doctor is sure that he has a correct preliminary diagnosis, this is not a guarantee. Secondly, the immunity influences the clinical picture quite a lot. It can change it. Neither me nor this woman saw classic blisters. However, both PCR analysis and the following appearance of antibodies to herpes genitalis confirmed this diagnosis, and the corresponding therapy led to healing. If any rashes appear in the area of skin and sexual organs, you can consult dermatovenerologists and dermatologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.